Imagine going to the doctor because, you're just totally exhausted, waking up gasping for air, and you finally get a diagnosis, right? Sleep apnea.
Right, a very common
Yeah.
scenario.
Yeah, and they send you home with the state-of-the-art CPAP machine. It's designed to force air into your airway, keep you breathing, so you strap it on, you go to sleep, and it completely fails.
Oh, absolutely fails.
The pressurized air hits your congested nose, severely irritates the lining, and just forces your mouth to pop wide open. All that life-saving air violently leaks right out of your lips, leaving you essentially suffocating all over again.
It really is a cruel irony, isn't it? I mean, the very treatment that's designed to keep your airway open ends up triggering the exact biological reflex that ruins the treatment.
Yeah.
And, well, it perfectly illustrates just how interconnected and really how fragile our nighttime breathing actually is.
And that right there is the mission of our deep dive today. We are going to unpack this bizarre, vicious cycle between chronic, unmanaged sleep apnea and overnight mouth breathing.
It's quite the loop.
It really is. We're pulling from a deep stack of clinical studies, physiological reviews, and expert guides on sleep-disordered breathing, because we want to explore the physics of why this happens, including a wildly counterintuitive trigger that literally starts in your legs.
Yeah, that one always surprises people.
We'll get to that, because it blew my mind. But we're also covering the consequences on everything from your dental health to the actual bone structure of a growing child's face. And most importantly, how you can break the loop.
It's a topic that really forces us to rethink a lot of basic assumptions. We tend to view the body as, a collection of isolated systems.
Right, like breathing is just the lungs.
Exactly. But when the respiratory system breaks down at night, the collateral damage hits almost every other system you have.
Okay, so let's unpack this, because our listeners already know the basics, right? We know human beings are supposed to breathe through their noses. We know the nose filters out pathogens, warms the air up, but there is a much more advanced biological reason why bypassing the nose is such a catastrophic shortcut, and it has to do with a specific gas.
Right, you're talking about nitric oxide.
Yeah.
Your paranasal sinuses are essentially a manufacturing plant for this gas.
Right.
When you inhale through your nose, you carry that nitric oxide down into your lungs. And nitric oxide is a powerful vasodilator.
Meaning it opens things up.
Exactly. It actively opens up the blood vessels in your lungs, expanding them so your blood can absorb oxygen much more efficiently.
So it's not just about, cleaning the air. It's about prepping your lungs to actually be able to use it.
Precisely.
And when you mouth breathe, you bypass that manufacturing plant entirely. You're just pulling cold, dry air into your chest, and you miss out on that nitric oxide boost, which means your blood is getting less oxygen with every single breath.
Yeah, you are taking a highly inefficient, totally dysfunctional shortcut.
Which brings up the obvious question, right? If nasal breathing is biologically superior and our bodies are hardwired to keep us alive, why do we ever switch to mouth breathing when we're unconscious? I mean, it seems like an evolutionary glitch.
It's not a glitch at all, actually. It's a panic response.
It's a panic response.
Yeah, your body will always prioritize getting some oxygen over getting it the optimal way. And this brings us to obstructive sleep apnea, or OSA. This condition happens when the upper airway physically collapses during sleep.
Right.
So when that airway caves in, your oxygen levels plummet, your carbon dioxide levels spike, and your brain essentially just hits the emergency alarm.
It panics.
It sends a desperate signal to fight for air. And the easiest, fastest way to get a massive gulp of air into the body, the jaw drops, the lips part, and you bypass the blocked nasal passage entirely.
It's an emergency release valve. Wait, if the goal is to get more air, opening the mouth seems like it would create a bigger, wider pathway. How does that actually make the sleep apnea worse?
Well, it comes down to the heavy, muscular anatomy of your head and neck. When your mouth opens and your jaw drops downward and backward, your tongue and your soft palate are physically dragged back with it.
Oh, wow.
Yeah, they collapse directly into your throat.
Yeah.
So by opening your mouth, you are physically narrowing the pharyngeal airway even more than it already was.
No, it backfires.
Completely.
Yeah.
When we look at the clinical data, obstructive apneas, where the airway totally collapses, and hypopneas, where it narrows enough to severely restrict airflow, are profoundly more frequent when a patient breathes through their mouth rather than their nose.
I was trying to visualize this mechanical failure earlier, and I just keep coming back to a thick milkshake and a flimsy paper straw.
Oh, that's a great analogy.
Right. If there's an obstruction, like a chunk of ice cream, and you pull really hard with your lungs to get air past it, that negative pressure just causes the walls of the paper straw to cave in on themselves.
That is a brilliant way to picture it. The harder your diaphragm pulls to suck air past a collapsing throat, the more those soft tissues get sucked inward. The physics just punish the effort.
So let's say I go to the doctor, I get diagnosed, and I get an oral appliance that successfully treats the sleep apnea. It holds my jaw in place, the obstruction is gone. Does the mouth breathing just automatically stop? Do I magically go back to nasal breathing?
You would certainly hope so, but no.
No.
The data reveals something really frustrating here. In a major study where patients were given oral appliances that successfully held their airways open, persistent mouth breathing still occurred in an astonishing 58.8% of cases.
Almost 60%, even with the physical blockage entirely removed.
Yes, because of muscle memory. Once you've been forced to breathe through your mouth night after night, it becomes this deeply ingrained neuromuscular habit.
Huh.
The muscles of your face, your lips, and your jaw have literally learned a new open-mouth resting posture. The original disease is gone, but your anatomy keeps taking the dysfunctional shortcut out of sheer habit.
The habit outlives the disease. That is wild. But I want to back up a bit because we need to look at the root cause.
Right.
We know sleep apnea forces the mouth open, and the open mouth makes the airway collapse further. But what triggers that initial collapse? What's the spark that starts the fire? Because I was looking through our research, and I found a trigger that I never in a million years would have associated with the throat.
Let me guess. The legs.
You're going to tell me it starts in the legs.
Yes. What's fascinating here is how fluid dynamics inside the human body link completely separate anatomical regions. We really need to talk about a physiological event called rostral fluid shift.
Hold on, you're telling me that having chubby ankles from sitting at my office desk all day is directly causing my windpipe to choke me out at night? That sounds like a massive leap.
It does sound crazy at first.
How does fluid in my calves defy gravity and travel all the way up to my neck in enough volume to do anything?
Well, it doesn't defy gravity. It actually obeys it.
Yeah.
During the day, assuming you're sitting or standing, gravity pulls the fluids in your body downward. Fluid naturally pulls in the intravascular and interstitial spaces of your legs.
Okay, sure.
And if you have a sedentary office job, or if you have a condition that causes you to retain water like heart failure, that pooling is significant.
Right. Everyone knows that feeling of taking your socks off after a long day and seeing those deep indents on your calves.
Exactly. But what happens when you go to sleep?
Yep.
You lie down flat. Gravity is no longer trapping that fluid in your lower extremities.
Oh, I see where this is going.
It redistributes. It shifts rostrally, which just means toward the head. And as that fluid rushes back into your upper body, the neck becomes a major bottleneck.
So the fluid actually physically accumulates in the neck tissues.
It does. It seeps into the tissues surrounding your upper airway, causing the pharyngeal mucosa to swell like a sponge, soaking up water. This drastically increases the tissue pressure around your windpipe, physically squeezing the airway shut and directly causing obstructive sleep apnea.
I still struggled to believe this when I read it. I mean, how do you even prove that leg fluid causes throat collapse? It feels like something that would be impossible to measure.
Oh, the researchers proved it using a frankly ingenious experiment. They took healthy subjects, along with patients suffering from heart failure, and put them in what are called lower body positive pressure devices while they were wide awake.
Which are basically anti-shock trousers.
Essentially, yes. They're inflatable pants that aggressively squeeze the legs, acting as an artificial gravity to force blood and fluid upward into the torso and head.
Okay.
When the researchers inflated these trousers on awake volunteers, squeezing the fluid out of their legs, they literally watched the subject's neck circumference increase in real time.
That is terrifying, just watching someone's neck swell up.
Very much so. They measured the pharynx physically narrowing. The effort required for the subjects to pull air through their throats skyrocketed. They artificially replicated the exact physiological conditions of sleep apnea in wide-awake people, simply by moving fluid from their legs to their necks.
Okay, my mind is completely blown. You squeeze the legs, the throat swells shut. But wait, if that fluid is rushing into the upper torso, then neck isn't the only thing there. What about the lungs?
Yeah, that is the second path this fluid can take. And it leads to an entirely different breathing crisis.
Which is?
In people with severe fluid retention, that rostral fluid shift floods into the lungs. This accumulation of fluid in the chest triggers a reflex in the brain that makes the person hyperventilate.
So they start breathing way too fast and too deep.
Yes. And when you hyperventilate, you blow off too much carbon dioxide. Your blood CO2 levels plummet. If those levels drop below a specific baseline known as the apnea threshold, your brain registers the lack of CO2 and effectively says, whoa, stop breathing for a moment so the carbon dioxide can build back up.
It just shuts down the signal to the diaphragm.
Entirely. This complete cessation of the respiratory drive is called central sleep apnea, or CSA. Your airway might be perfectly open, but your brain forgets to tell your lungs to pull.
So just sitting all day causes a fluid shift. That fluid either swells your neck shut, causing obstructive sleep apnea, or it floods your lungs and tricks your brain into pausing your breathing, causing central sleep apnea.
Exactly.
Either way, you stop breathing, your body panics, and your mouth falls open to gasp for air. We have found the loop.
We have. And breathing through an open mouth for 8 hours a night while locked in this loop comes with a devastating biological cost.
Let's get into the systemic fallout, starting with adults, because we talked about how mouth breathing skips the humidification of the nose. If you are waking up at 3 a.m., desperately chugging a glass of water from your nightstand, this is why, right?
It is. Breathing out through your mouth increases respiratory water loss by a staggering 42% compared to nasal breathing.
22%.
You are actively evaporating your body's moisture straight through your open lips.
That sounds awful.
It creates severe chronic dry mouth. And that is not just uncomfortable, it is a major health hazard. Saliva is nature's ultimate mouthwash. It neutralizes the acids in our food, it supplies minerals that remineralize our enamel, and it keeps oral bacteria in check.
Suet.
When you remove that saliva for 8 hours every night, you turn your mouth into a breeding ground for harmful bacteria.
Okay.
This directly causes chronic bad breath, accelerates tooth decay, erodes your enamel, and leads to severe gum disease.
So a mechanical breathing issue turns into an incredibly expensive, painful dental issue. It's all connected.
Very much so.
Speaking of connections, I want to talk about a very specific demographic. Why is it that sleep-disordered breathing jumps by 200% in postmenopausal women? That is a massive spike.
It comes down to a sudden loss of structural support, driven by hormones. Estrogen and progesterone do a lot of things, but one of their hidden roles is maintaining muscle tone throughout the body.
Okay.
That includes the pharyngeal dilator muscles, the muscles that act as the literal scaffolding holding your throat open.
So when those hormone levels naturally drop during menopause,
That muscular scaffolding loses its tone. It gets lax. The airway becomes drastically more vulnerable to caving in under negative pressure, leading directly to a spike in apnea, and consequently a massive increase in overnight mouth breathing.
it just highlights how delicate the internal balance is. But if you think the adult consequences are severe, the impact on children is downright tragic. The prevalence of mouth breathing in kids is estimated to be anywhere between 11% and over 56%.
It is an epidemic. And the consequences of untreated pediatric OSA are uniquely devastating because children are in active development. When a child's airway collapses, they are constantly jolted out of deep sleep as their tiny bodies fight for air.
And deep sleep is when the magic happens for kids.
Deep sleep is the exclusive window when the body releases massive surges of growth hormone. If sleep apnea shatters that deep sleep architecture, that hormone release is stunted. We see a failure to thrive, poor weight gain, delayed physical development, and heavily disrupted hormonal imbalances that contribute to severe bedwetting.
But the part that really got me was the psychological fallout. Because, an adult who doesn't sleep well acts lethargic. But a child who doesn't sleep well acts out.
This is a critical point. A chronically sleep-deprived child running on a continuous loop of fight-or-flight adrenaline because they are suffocating every night does not just sit quietly and yawn.
Right.
Their cortisol levels spike. They become hyperactive, impulsive, irritable, and completely unable to focus or regulate their emotions.
They display the exact classic symptoms of ADHD.
Yes, and it is heartbreaking to think about how many children might be misdiagnosed with behavioral disorders or prescribed heavy stimulant medications when the actual root cause is that their tonsils are swollen and they literally cannot breathe when they lie down.
Imagine trying to medicate a kid into sitting still when they are running on months of fragmented, low-oxygen survival sleep.
Exactly.
But beyond the behavioral issues, there is a visual, undeniable consequence of pediatric mouth breathing. It literally alters the shape of their skull.
It's known clinically as adenoid face. The human face doesn't just grow based on genetics. It is heavily shaped by the mechanical forces applied to it during development. In a healthy child who breathes through their nose, the lips are sealed and the tongue rests flat and wide against the roof of the mouth.
The tongue acts like a natural expander for the palate.
Precisely. The tongue is a massive, incredibly strong muscle.
Mhm.
The constant, gentle upward pressure of the tongue against the hard palate forces the upper jaw to widen and develop a broad, U-shaped arch.
Okay, making room for everything.
But if a child is chronically mouth-breathing to survive sleep apnea, the lips are parted, and the tongue drops down to the floor of the mouth to let air pass over it.
So that internal scaffolding is just gone.
Gone. Without that outward pressure from the tongue, the upper jaw grows narrow. The inward pressure of the cheek muscles dominates. Over years of development, this mechanical imbalance pulls the facial bones downward, leading to a long, narrow face, a recessed chin, a high, vaulted palate, and because the jaw is now too small, severely crowded and crooked teeth.
The body literally reshapes the skull to accommodate the dysfunctional breathing. It's terrifying, but it also proves how mechanical this whole cycle is. So what does this all mean for you, the listener? If you are trapped in this fluid-shifting, jaw-dropping loop, how do we fix it?
We have to tackle it in stages. Let's start with the immediate environment and gravity. If rostral fluid shift is the enemy, sleeping completely flat on your back is the worst possible position. It allows gravity to pull fluid into your neck and pull your tongue backward into your airway.
So elevate the head of the bed or sleep on your side to mitigate the fluid pooling. What about the bedroom itself?
You must protect your nasal mucosa. If your bedroom is dusty or the air is bone dry from a heater, the delicate lining of your nose will become inflamed and swell shut. That forces the mouth open.
Makes sense.
Using a high-quality HEPA air purifier and running a humidifier to keep the bedroom humidity between 30% and 50% can soothe those passages and dramatically reduce inflammation.
Okay, the room is clean, you're on your side. Let's talk about the behavioral fixes, because earlier we established that even if you cure the apnea, 60% of people still mouth breathe out of sheer habit. How do we break the muscle memory? I want to talk about myofunctional therapy, which sounds like going to the gym for your face.
That is exactly what it is. Myofunctional therapy involves highly targeted exercises to strengthen the tongue and throat muscles and retrain the brain's default resting oral posture.
Give us an example of an exercise. What does this look like in practice?
A classic exercise involves suctioning the entire tongue flat against the roof of the mouth, almost like you're about to click your tongue, but holding it there. You hold that suction, feeling the tension in the base of the throat, and practice swallowing and breathing through your nose while maintaining that seal.
I can imagine that's tough if you're not used to it.
It feels incredibly unnatural at first for a chronic mouth breather, but over time, it physically tones the airway muscles and rewires the neuromuscular habit. The mantra is lips sealed, teeth lightly touching, tongue on the roof of the mouth.
And to help enforce that seal while you're asleep, the research dives into mechanical aids, specifically mouth tape. Now, taping your mouth shut sounds like a hostage situation. I can imagine a lot of listeners balking at that.
Which is why we need to be incredibly clear about what this is. We are not talking about taking a strip of heavy-duty duct tape and sealing your lips shut. We are talking about specialized, porous, hyperallergenic tape, like myotape, that often sits entirely around the perimeter of the lips, not over them.
So it's not a hermetic seal.
No, it's a neuromuscular cue. The goal is to provide a subtle, physical reminder to the brain. As you drift into deep sleep and the jaw muscles relax and start to drop open, the slight pulling sensation of the tape triggers a reflex that cues the muscles to snap back shut. It's a gentle nudge.
Though obviously if you've been drinking heavily, if you've taken sleeping pills, or if you feel nauseous, you never ever restrict your mouth.
Absolutely. Safety first. A chin strap is an alternative that provides upward support for the jaw. But here is the critical caveat. Neither tape nor straps will work. And in fact, they will cause you to suffocate if there is a fundamental medical or structural blockage in your nose.
Which brings us to the medical and surgical tier, because you can tape your mouth all you want, but if you have a deviated septum, you just can't get the air in.
Exactly. If you have nasal polyps, a severely deviated septum, or massively enlarged tonsils blocking the physical tube, you require an ear, nose, and throat specialist. Sometimes, physically cutting away that blockage is the only way to reestablish a functional airway.
And this circles back to the CPAP machine paradox we talked about at the very beginning of the deep dive. The compliance rates for CPAP machines are notoriously terrible, like 50 to 60%.
They are. Because if a doctor prescribes a CPAP to force air down your throat, but you have chronic nasal congestion or a deviated septum, that high-velocity air violently irritates the nasal passages. It dries them out. The physical discomfort and resistance cause the patient's mouth to blow open in the middle of the night.
And the air just takes the path of least resistance, flowing in the nose and straight out the mouth. totally bypassing the lungs.
Precisely. The treatment for the apnea induces the mouth breathing, which entirely nullifies the treatment. This is why clinical reviews stress that nasal surgery is sometimes absolutely mandatory, not to cure the sleep apnea directly, but purely to clear the runway so a patient can actually tolerate their CPAP machine.
Yeah.
You cannot fix the system if the primary intake valve is blocked.
It is a phenomenal, interconnected web. To synthesize everything we've unpacked today, chronic sleep apnea and overnight mouth breathing are locked in a vicious, self-perpetuating cycle. And the spark that lights the fire can be as simple as gravity. Fluid pools in our legs from sitting all day. We lie down, that fluid shifts into our necks, swelling the tissues and physically squeezing the airway shut. The body panics, the jaw drops to get air, and that very action drags the tongue backward, collapsing the airway even further. And the fallout is total system failure. We evaporate our body's moisture, rot our teeth, severely fragment our deep sleep. And in children, we misdiagnose them with behavioral disorders while their facial bones literally warp into longer, narrower shapes to accommodate the dysfunction.
If we connect this to the bigger picture, it is a stark reminder that breathing is not just some passive background process. It is the fundamental biological pacemaker that dictates the health of your hormones, your brain, your heart, and your skeletal structure. The anatomy dictates the function. The mouth is for eating, and the nose is for breathing. When we blur those lines, the entire system pays a heavy toll.
It's a toll that compounds night after night, breath after breath. And it leaves me with one final, slightly unsettling thought for you to mull over. We established that sitting at a desk all day causes fluid retention in the legs.
Right.
That fluid shifts to the neck at night, inducing sleep apnea. The sleep apnea forces the mouth open, which, as we learned, literally alters the mechanical forces that shape the human skull, leading to that longer, narrower, adenoid face in growing children. So here is the question. As we move further and further into a society entirely dominated by screens, modern office jobs, and highly sedentary lifestyles, are our day jobs literally changing the evolutionary shape of the human face over time?
Oh, that is a fascinating question.
It's something to think about the next time you find yourself slumping in your office chair. Thank you so much for joining us on this deep dive into the hidden mechanics of breathing and sleep. Until next time, take a second right now and check where your tongue is resting.